daily cleaner. Saline solution is a sterile salt water solution that is used to rinse and store contact lenses. It is isotonic, which mean that it has the same salt concentration as tears. This helps to keep the lenses moist and comfortable. Saline solution does not clean or disinfect contact lenses, so it should not be used as the only solution for contact lens care. Multi-purpose solutions is a one bottle system that can be used for cleaning, disinfection and storing contact lenses. It is convenient because it only requires one bottle of solutions. Multi-purpose solution typically contain surfactant and preservatives and buffers. Surfactants help to break down and remove dirt, debris and proteins from the lenses. Preservation helps to prevent them grow and bacteria and other microorganisms in the solutions. Buffer help to keep the pH of solution content, which is important to keeping the lenses clean and comfortable. Lens weighting, soaking and solutions. Lens weighting soaking solution are used to hydrate and lubricate contact lenses. They typically contain surfactant, weighting agent and viscosity enhance agent. Surfactant help to break down and remove dirt, debris and protein from the lenses. Weighting agent help to keep the lenses moist and comfortable. Viscosity enhance agent help to thicken and solution so that it can more easily coat the lenses. It is important to choose a contact lens care solution that is appropriate for your individual need. If you have sensitive eyes, you have choose a solution that is preservative free. If you are prone to your protein buildup, you should choose a solutions that contain a enzyme cleaner. Next, contact lens care, soft and rigid lenses. Contact lens care is important for keeping your eyes healthy and your contact lenses clean and comfortable. It includes cleaning, disinfecting and storing your lens properly. Deposits are any lens surface coating formation which is not fluid from a lens by tear during blinking. They can form on the surface of contact lenses over time and can cause discomfort, irritation and even infections. Type of deposits. There are two main type of deposit that can form on contact lenses. External deposits are caused by things that come into contact with the lens from the outside, such as eye makeup, air pollutions and tap water. Internal deposits are caused by things that are produced by the eye, such as tears, proteins, lipids and mucus. Preventing deposits. There are a few things can do to prevent deposit from forming on your contact lens, like wash your hand thoroughly with soap and water before handling your eye lenses. Do not use tap water cleaning or rinse your lenses. Use a contact lens care solution that is appropriate for your individual needs. Clean, disinfected and store your lenses properly according to the manufacturer instructions. Treating deposits. If deposits do form on your contact lenses, you can treat them by following these steps. Number 1. Clean your lenses thoroughly with a contact lens care solution that contain an enzyme cleaner. Number 2. Disinfection your contact lens according to the manufacturer's instructions. Number 3. Store your lenses in fresh solution. If you are experiences discomfort or irritation, you should see your eyes doctor and optometrist. They may be able to prescribe a medical to treat a discomfort or irritations. How do protein deposits get denatured? By following these steps or tips, you can help keep your eyes healthy and your contact lenses clean and comfortable. Image of native protein, environmental factor, and denatured protein. This image show a native protein, which is a protein that is in its natural state. The protein is folded into a specific shapes that allow it to function properly. The image also shows a denatured protein, which is a protein that has been changed from its natural state. The protein is no longer flooded properly and it unable to function properly. The environmental factors that can cause protein denaturations are shown in between the native and denatured proteins. These factors can infected or including heat, pH charges, and presence of chemicals. Next, deposit complications. Deposit complications decrease visual acuity. Protein deposit can interfere with the ability of contact lenses to focus light properly, which can lead to decreased visual acuity, lens dryness, irritations, and decreased comfort. Protein deposit can make contact lenses feel dry, irritation, and uncomfortable. This can be due to the fact that protein can block the pores on the surface of the lenses, which prevent them from getting enough oxygen. Shortened wear time. Protein deposit can make contact lenses comfortable to wear, which can lead to people wear them for shorter periods of times. This can increase the risk of the eye infections, causes allergic response. In some people, protein deposit can cause an allergic response. This can manifest as symptoms such as itching, redness, and swelling of the eyes. If you experience any of these symptoms, it is important to see your doctors. Here are some tips to help prevent protein deposit from forming on your contact lenses. Clean your lens thoroughly and roughly. Use a contact lens solution that contains an enzyme cleaner. Store your contact lens in a clean, dry cases. Do not wear your contact lenses for longer than the recommended time. See your eye doctor regularly for checkup. Next, care and maintenance of rigid lenses. Rigid gas permeable lenses are a type of contact lens that are made of a hard, durable material. They are often prescribed for people with astigmatism or other conditions that make it difficult to wear soft contact lenses. Care and maintenance of RGP lenses is important to ensure that they are clean, comfortable, and safe to wear. Here are some tips for care for RGP lenses. Clean your lenses thoroughly and roughly. Use a contact lens solution. This is specially designed for RGP lenses. Rinse your contact lenses or RGP lenses with fresh solutions before storing them. Store your lenses in a clean, dry case. Do not wear your lenses for longer than the recommended time. See your eye doctor regularly for the checkup. Proper care and maintenance of RGP lenses can help to prevent a number of problems including infection, irritation, discomfort, damage to the lenses. If you experience any problem with your RGP lenses, it is important to see your optometrist and doctor immediately. They can help you troubleshoot the problem and find the solutions. After care visiting are important for all contact lens wearers, but they are especially important for the people who wear RGP lenses. During an aftercare visit, your eye doctor will check the fit of your eye lenses. Make sure that they are clean and comfortable and answer any questions you may have to ask your teachers. Thank you. And next slide is rigid lens materials. Characteristic of rigid lens materials: small matrix pores. Rigid lenses material is made up of a matrix of small pores. These pores allow oxygen to pass through the lens, which is important for keeping the eye health. And however, the small pores also make it difficult for protein and other debris to be removed from the lens. This can lead to deposit on the lens surface, which can cause discomfort and irritation. Deposits remain on the lens surface. Rigid lenses are more prone to protein and lipid deposits than soft lenses. This is because the small pores in the lens material make it difficult for these substances to be removed. Deposit on the lens surface can cause discomfort, irritations, and decreased vision. Complex surface chemistry. The surface or rigid lenses has a complex chemistry. This chemistry can interact the protein with other substance in the tears, which can lead to deposit on the lens surface. Silicone component decreases weight ability. Rigid lenses that contain silicone are less weightable than lenses that do not contain silicones. This means that they are more likely to feel dry and uncomfortable when worn. Rigid lens handling techniques. Insertion and removal. When insertion and removal rigid lenses, it is important to follow the instruction of the eye doctor. It is also important to wash your hand thoroughly with soap and water before handling your lenses. Accidental lens ejection and displacement. If a lens is accidentally ejected from the eye, it is important to try to retrieve it as soon as possible. If the lens cannot be retrieved, it is important to see your eye doctor as soon as possible. Emergency lens removal. If a lens becomes stuck in the eyes, it is important to remove it as soon as possible. There are a number of the techniques that can be used to remove a stuck lens. The most important affecting techniques will depending on the specific solutions. Storage and removal from the case. When storing rigid lenses, it is important to use a clean dry cases. It is also important to use a contact lens solution that is specially designed for rigid lenses. Rub and rinse process. The rubs and rinse process is a method of cleaning rigid lenses. They remove deposits and debris from the lens surface. The process involves rubbing the lenses with a cleaning solution and then rinsing them with fresh solutions. Next, rigid lens measures. Rigid lens generally measures good hygiene. It is important to practice good hygiene when handling rigid lenses. This includes washing your hand thoroughly with mild soap and warm water before handling your lenses. It is also important to avoid wearing your lenses if your hands are dirty or if you have any cuts and abrasions on your hand and free of debris, lotions and rough surface. It is important to make sure that your hand are free to debris, lotions and rough surface before handling your lenses. Debris and lotion can scratch the lenses, while a rough surface can irritate your eyes. Rigid lens care product. Wetting solutions. Wetting solution is used to rehydrate and lubricate rigid lenses. It helps to keep the lenses moist and comfortable when they are being worn. Cleaner. Cleaner is used to remove dirt, debris, and proteins from rigid lenses. It is important to clean your lens roughly before storing them. Disinfection agents. Disinfection agents is used to kill bacteria and other microorganisms on rigid lenses. It is important to disinfect your lenses after cleaning them. Lubricating solution. Lubricating solution is used to relieve dryness and irritation caused by rigid lenses. It can be applied to the lenses before or after wearing them. By following these steps, you can help to ensure that your rigid lenses are clean, comfortable and safe to wear. Here are some additional tips for cleaning and caring for rigid lenses. Do not use tap water. Do not share your lens. Replace your lenses and care. See your eye doctor regularly. Thank you. And go to next page. Rigid lens techniques. Rigid lens cleaning is a part of rigid lens techniques. Daily surfactant. Daily surfactant is the mild cleaner that is used to remove dirt, debris and proteins from rigid lenses. It is important to clean your lenses thoroughly with a daily surface before short them. Enzymatic cleaner. Enzymatic cleaner is the more powerful cleaner that is used to remove stone deposit from rigid lenses. It is important to use enzyme cleaner only as directed by your eye doctor. Polished. Polish is a mild abrasive that is used to remove scratches and scuff from rigid lenses. It is important to use polished only as directed by your eye doctor. Rigid lens techniques should avoid vigorous rubbing. Vigorous rubbing can scratch the lenses or damage the fit. Excessive pressures on lens. Excessive pressure can damage the lens or cause discomfort. Prolonged cleaner with a mildly absorbed cleaner. Prolonged cleaner with a mildly absorbed cleaner can change them the lenses. By following the steps, you can help the ensure that your rigid lenses are clean, comfortable and the safe wear. Next, contact lens complication, soft and rigid lenses. Physical factors. Physical factors number 1, poor fit. A poor fitting contact lens can cause discomfort, irritation and even corneal aberrations. Number 2, foreign bodies. If a foreign body such as a piece of dust or dirt gets under the contact lens, it can cause pain, redness and inflammation. Number 3, inverted injuries. Contact lenses can easily damaged if you are dropped and mishandled. This can lead to scratch, crack or even perforations in the lens, which can cause eye pain, infection and vision loss. Visual factors. Uncorrected refractivity. If a contact lens is not properly prescribed, it can cause blurred visions, double visions and other visual problems. In inadequate cleaning and disinfections. If contact lenses are not properly cleaned and disinfected, they can harbor bacteria and other microorganisms that can cause eye infections. Prolonged wear contact lenses for longer than the recommended time can increase the risk of the eye infections, corneal ulcer, and other complications. Physiological factors: dry eyes. People with dry eye are more likely to experience discomfort, irritation from the contact lenses. Allergics. People with allergies are most likely to experience inflammations and irritations from contact lenses. Eye disease. People with certain eye disease such as corneal ulcer are more likely to experience complication from contact lens. Pathological factors: infections. Contact lens can harbor bacteria and other microorganisms that can cause the eye infections. Corneal ulcer. Corneal ulcer are a serious complications of contact lens where they can cause pain, reduce and decrease visions. If the left undertreated, corneal ulcer can lead a scarring and even blinding. Neovascularization is the growth of the new blood vessels. The cornea can be caused by prolonged contact lens wear. Neovascularization can lead the corneal scarring and decreased visions. Where are related non-compliance. People who do not follow in the instructions of their eye doctor for cleaning, disinfecting and wearing contact lens are most likely to experience complications. Improper handling. People who misaligned contact lenses, such as by dropping them or rubbing them too hard, are more likely to damage the lenses or causes eye injury. Poor hygienic. People who do not practice good hygienic, such as by washing their hand before handling contact lenses, are more likely to spread bacteria and other microorganisms that can cause eye infections. Contact lens complications. Ocular discomfort is a general term used to describe any type of pain, irritation, or discomfort in the eye. It is the most common contact lens induce conditions, and it can range from mild to severe. Cause of ocular discomfort. Poor fit. A poorly fit contact lenses can cause discomfort by rubbing against the cornea, the clean front part of the eye. Deposits. Protein and lipid deposits can build up on the contact lens over the time, which can cause discomfort and irritations. Infections. Contact lens can rub bacteria and other microorganisms that can cause infections. Allergies. Some people are allergic to the materials used to make contact lenses. This can cause discomfort, redness, and itching. Dry eye. People with dry eye are more likely to experience discomfort from contact lenses. Symptoms of ocular discomfort. Pain. The most common symptom of ocular discomfort. Irritations. The eye may feel itchy and red or watery. Foreign body sensations. The person may feel like there is something in their eyes. Blurred visions. The persons may have difficulty see clearly. Treatment for ocular discomfort. The treatment for ocular discomfort deposit on the underlying cause. In some cases, the discomfort may go away on its own. In other cases, the person may need to see their eye doctor for treatment. Treatment options may include removing the contact lenses. This may be the only treatment needed if the discomfort is caused by a poorly fitting lens or by deposing on the lens. Cleaning and disinfections the contact lenses. This may be necessary if the discomfort is caused by bacteria or other microorganisms. Prescribing medication. In some cases, the eye doctor may prescribe medications and to the help relevant the discomfort. Medications may include antibiotics drops, anti-inflammatory drops, or lubricating drops. Preventing ocular discomfort. There are a number of things that can be done to prevent ocular discomfort, including getting a proper eye exam and prescribed from an eye doctor. This will be ensure that the contact lenses and proper fitted and will not cause any discomfort or irritations. Flowing the instruction of your eye doctor, this including cleaning, disinfecting, and wearing the lenses properly. Practicing good hygiene, this includes washing your handle thoroughly with soap and water before handling your lens. Not wearing contact lenses for longer than the recommended time. This will help to reduce the risk of eye infecting and other complications. Taking a break from wearing contact lenses. It is recommended to take break from wearing contact lenses for at least 4 to 6 hours per day. Wearing glasses when you don't need to see clear. This can help to reduce an amount of the time of your spent wearing contact lenses. Seeing your contact lenses with consult your eye doctor regularly. This is important to check the fit of your lenses and for detecting any prevention problem early on. Contact lens complications. Dry eye is the disorder of the tear film, the thin layers of fluids that coats the eye and keep it moist. Dry eye can be caused by a number of factors, including decreased tear productions, inflammation of the tear gland. Symptoms of dry eyes: irritations, watering, blurry visions, redness, and sensitivity to the light. Treatment for dry eyes. Treatment for dry eyes depend on the underlying causes. In some cases, the dry eye may be go away from its own. In other cases, the persons may have need to see their eye doctor for treatment. Treatment options may include artificial tears. Artificial tears are available over the country and they can help to lubricate the eye and relevant symptoms. Restorsis is prescribing medical that can help to increasing tear productions. Cyclosporine ophthalmic emulsions. This is a prescribed medication that can help to reduce inflammations in the tear gland. Omega-3 fatty acid are available as dietary supplement and may help to improve tear productions. Heat therapy. Heat therapy can help to increase blood flow to the tear gland and improve tear productions. Lead massage. Lead massage can help to remove debris from eye lids and improve tear productions. Bulbar dryness is a specific type of dry eye that affected in the white part of the eyes and sclera. It is the bulbar redness I will show in slide. It is characterized by a dry, rough or clay appearance of sclera. Contact lens complications. Pupillary conjunctivitis is a condition that causes small raised bumps to form on the conjunctiva. The clear tissue that lines in inside of the eyelid and over the white part of the eye sclera. Pupillary conjunctivitis is often caused by wearing contact lens, but it can also be caused by other factors such as allergies, dry eyes, and infections. Sign and symptoms of pupillary conjunctivitis: redness, swelling, uh, discomfort, watering, and blurring visions. Cause of pupillary conjunctivitis: contact lens wear, allergy, dry eye, and infections. Treatment for pupillary conjunctivitis. The treatment of pupillary conjunctivitis depend on the drying underlying cause. In most cause, pupillary conjunctivitis will go away on the own. However, if the condition is several or does not go away on its own, the person may need to the seen their eye doctor for treatment. Treatment option may include artificial tears. Artificial tears can help to lubricate the eye and relevant symptoms. Over-the-counter medication. Over-the-counter medication such as anesthetic and can be help to relieve symptoms. Prescriptions medications. In some cases, the eye doctor may prescribe prescription medications such as antibiotics or anti-inflammatory medications. Contact lens discontinuations. Contact lens discontinuations. Sorry. In some cases, the eye doctor may recommended the person discontinue wearing contact lenses until the condition has removed. Whole content summary. In this video, we have discussed the following tips and topic. Contact lens are dry eye. Contact lens can cause dry eye. This is because the contact lens can interfere the normal tear film, which is a thin layer of tear that coats the eye and keep it moist. When tear film is disturbed and the eye can become dry, irritation, and uncomfortable. Water content of contact lenses. Contact lens dehydrations and induced dryness. Symptoms of dry eye. Thank you for watching this video. I hope that you found it informative. If you have any questions, please feel free to leave a comment below and via to mail or WhatsApp through your university and institute. Thank you again.